Good morning, everyone. Thanks for joining us. I hope you had a good summer, and I'd like to wish all parents, students, and teachers the best as another school year is upon us and as classes resume this week. I'm being joined this morning by Minister Shandro, Dr. Hinshaw, and Dr. Verna Yu, who are joining us today because COVID-19 is surging once again in Alberta. As it is everywhere across the country and most of the world, the Delta variant of COVID-19 is causing concerning rises in hospitalizations in our province, almost entirely amongst unvaccinated Albertans. COVID-19 vaccines continue to provide amazing protection against infection and severe disease, even with the Delta variant. So I'd like to thank the 2.9 million Albertans who have chosen to roll up their sleeves. Yesterday, we reached the critical milestone of having 70% of our eligible population fully vaccinated. That's to say 70% of Albertans aged 12 and over. 78% of eligible Albertans have received at least a first dose. This is an important achievement, especially when you consider that Alberta has Canada's youngest population. But the bad news is that we still have 30% of the eligible population without full vaccine protection, that is to say without 2 doses. And the Delta variant is ripping its way through this group at an aggressive rate. When we lifted restrictions on July the 1st as part of our Open for Summer plan, the Delta variant was actually in decline in Alberta. We proceeded with that plan based on our Chief Medical Officer's analysis of data from countries like the United Kingdom that showed that while Delta did cause a spike in cases, it did not have a dramatic impact on severe outcomes leading to hospitalizations and deaths. In effect, cases and severe outcomes had become increasingly decoupled. Unfortunately, this has not been Alberta's experience at the population level. Vaccines do decouple individuals, from severe outcomes dramatically on an individual level. But because of the large group of people who have no vaccine protection, we have seen the Delta variant spread widely and cause severe outcomes at much greater rates in unvaccinated adults. This is true even amongst younger adults. As an example, since July the 1st, unvaccinated people between the ages of 20 to 59 have had 50 to 60 times higher risk of hospitalization than those who are vaccinated. Let me just repeat that. People between 20 and 59 who are not vaccinated have 50 to 60 times greater chance of hospitalization than those who are fully vaccinated. Overall, unvaccinated people have made up more than 80% of all hospital admissions since July the 1st. And since August the 1st, we've seen a steady increase in the number of COVID-19 patients in hospital in both ICU and non-ICU, with a rapid acceleration in the past week. On August 24th, we had 243 non-ICU patients in hospital. But on September the 1st, just 8 days later, we had 373, an increase of 54%. The intensive care situation is even more serious. On August 24th, there were 59 COVID patients in intensive care, and on September the 1st, there were 114. That's a 93% jump. But the vaccination status of the patients behind these numbers tells the real story. Of the 373 non-intensive care patients in hospital, 80% of them are unvaccinated. Of the 114 in intensive care, it's over 91% unvaccinated. So please get vaccinated. These numbers say it better than anybody ever could. The reality is that we as a government don't get to choose how the virus behaves or how many people choose to protect themselves against it. We just have to find a way of limiting the damage that it causes, especially to our healthcare system. The bottom line is this: 4 out of 5 Alberta adults have protected themselves and helped reduce transmission by getting vaccinated. But 1 out of 5 Alberta adults have not. And their choices are now jeopardizing our healthcare system. So I'm going to be blunt. If you are unvaccinated, it is urgent that you protect yourself, our hospitals, and our entire community by getting the benefit of this miracle of modern medicine as soon as possible. If you have received only one dose, please step forward for your second dose, which provides powerful additional protection. What are you waiting for? You've already had the first dose. Please step forward for that second dose. If you have concerns about the safety of the vaccines, please speak to your medical doctor or pharmacist. And if you just haven't gotten around to it, for the love of God, please get vaccinated now. And if you do, we will now pay you $100. Today, we are announcing that Alberta will be the first province to offer a personal monetary incentive to step up and do the right thing. Anyone who gets a first or second dose will now be eligible to receive a $100 gift card. Minister Shandro will provide details in a moment. Over the last 2 days, the COVID Cabinet Committee has received advice from officials in Alberta Health Services and Alberta Health, including Dr. Hinshaw, and has decided on a course of action to do just that. And Dr. Hinshaw will share case growth and hospitalization modeling in a moment. I know all of this is frustrating to hear right now. Many of you had hoped we were done with the severe waves of COVID-19 that test the capacity of our healthcare system. Goodness knows that includes me. To parents, I know you're feeling some anxiety as this fourth wave rises and vaccines remain unavailable to kids under the age of 12. But please know that our back-to-school plan is in full accordance with the Chief Medical Officer's recommendations, and who continues to watch the situation very closely. And as we know, COVID poses a less severe risk to the health of younger children than the regular flu, and than many other health risks. To seniors in congregate care and the immunocompromised, please know you are now eligible for a third booster dose. With the Delta wave surging, I urge you to please book that third dose to strengthen your level of protection based on what we've learned in other places like Israel. My final message is to those of you, once again, who have not chosen the vaccine. As the numbers shared earlier clearly show, this is essentially now a crisis of the unvaccinated. The overwhelming majority of severe cases and outcomes that are putting pressure on our hospitals are occurring in unvaccinated patients. Unvaccinated people are about, as I said, in those age ranges, 50 to 60 times more likely to be hospitalized than those who have the protection. So you are putting yourself at risk, and you're putting our healthcare system at risk. Your decision does not just affect you, it affects more than you. Today, Dr. Yu is going to be announcing surgery postponements in various parts of the province. That is a direct result of the pressure in the healthcare system coming from people who have chosen not to be vaccinated. Your personal choice has very real world social consequences. Before I close, I'll say that this wave, like the others before it, will come to an end. And unfortunately, there will be waves to follow it. We still must learn to live with COVID-19 in a way that is as close to pre-pandemic normal as possible. That remains this government's overall goal in responding to the virus. Some waves will be worse than others, but how much worse is still up to all of us. Thank you, and with that, I will turn it over to Minister Shandro.
Thank you, and good morning, everyone. As Premier noted, the COVID-19 pandemic has changed, and our response to it needs to change as well. COVID-19 has become essentially a pandemic, as the Premier said, of the unvaccinated, and that means that the path out is still clear. But the Delta variant is causing a concerning rise in hospitalizations, and we need to be able to respond to it. COVID-19 vaccines continue to provide excellent protection, even against Delta, and I want to thank the 2.6 million Albertans who have chosen to roll up their sleeves. Now, yesterday, we reached the critical milestone of having 70% of our eligible population here in Alberta fully vaccinated. So that's 70% of all of us who are 12 and older. And that's truly an amazing achievement, especially when you consider that we have a much younger population than other provinces do. The problem is that we still have 30% of the population without full vaccine protection. And the Delta variant is moving through them faster than previous forms of the virus and faster than we expected even up to a few weeks ago. When we lifted restrictions on July 1st, as part of our Open for Summer plan, the Delta variant was actually in decline in Alberta. And we proceeded with that plan based on Dr. Hinshaw's advice and data from the United Kingdom and other countries. And that data showed that Delta caused a spike in cases, but didn't have the same impact on hospitalizations and deaths, that there was a decoupling of cases and hospitalizations, that the cases were decoupled from severe outcomes, I should say. Unfortunately, we're not seeing the same decoupling that we expected in terms of the whole population. For vaccinated people, we absolutely are seeing a dramatic drop in the risk of severe disease, and the effect is real. The vaccines work as well as we could possibly hope. The problem is simply that there are still too many unvaccinated people. The Delta variant is moving through them faster than we expected, and even though they're mostly younger people on average, it's making enough of them seriously sick to strain the hospitals here in Alberta. And we need to be really clear. The vaccines are not failing. Vaccines work. The problem is simply that a more contagious variant means that we need more people vaccinated to finally put this thing behind us. We honestly thought that we'd be there by now, and we would have been. Now we just need to push vaccine coverage higher than we expected. And in the meantime, as we've said all along, we have to make sure that the health system keeps the capacity to treat everyone who needs care. A few numbers to try and help tell the story here. Since July 1st, unvaccinated folks between the ages of 20 and 59, we have had a 50 to 60 times higher risk of hospitalization than those who are vaccinated, as Premier said. Overall, unvaccinated folks have made up more than 80% of all hospital admissions since July 1st. In terms of serious impact, this is a pandemic of the unvaccinated. But it's still having an impact, and for now, that impact is just too high. Since August 1st, we've seen a steady increase in the number of COVID patients in hospital in both ICU as well as our non-ICU hospital beds. And this has accelerated in the last week, with 107 COVID patients in ICU as of the 31st, compared to 59 on August 24th. And similarly, we are at 358 non-ICU cases on August 31st, compared to, if you look again to August 24th, 243. So the reality is that we don't get to choose how the virus behaves. We just have to find a way of limiting the damage that it causes. Over the last 2 days, the COVID Cabinet Committee has received advice, as Premier said, from officials in AHS as well as the Ministry of Health, and that includes Dr. Hinshaw, and has decided on a course of action to do just that. And as Premier said, we've been watching the impact of COVID on our hospitals very carefully, and we believe we need to bring back measures that we know have worked throughout the pandemic in the past. So starting at 8 a.m. tomorrow, Saturday, September 4th, masks will again be mandatory in all indoor public spaces and workplaces here in Alberta. For workplaces, that means that employees must mask for all indoor settings except for workstations or where 2-meter physical distancing or adequate physical barriers are in place. This also means that masking on public transit will remain in effect until further notice. Masking in acute and continuing care was previously extended, so let me remind you that we must continue to wear masks at any of those facilities. Now, regarding schools, school boards will continue to set COVID management policies as they deem appropriate. The provincial mask mandate will not need to apply to schools. Masks will help slow the spread of the virus and the impact on the health system, and this is a step that we can take with minimal disruption of businesses and people's normal activities. We're also requiring all licensed establishments to stop alcohol sales by 10 p.m. So this includes all restaurants, cafes, bars, nightclubs, as well as pubs. They can remain open past 10 p.m., but without liquor service. And I'd like to recognize our restaurant and hospitality operators and entrepreneurs who have pivoted several times during the pandemic and have shown exceptional resiliency throughout it all. We know that this is disruptive to your operations, and we appreciate your willingness to continue to adapt in the interest of protecting your staff and protecting your patrons. Unfortunately, we continue to see high case numbers and low immunization coverage among younger people, and we need to take this step to reduce spread and to protect our healthcare system. To further reduce contacts, we're recommending that, wherever possible, employers pause their plans for staff to return to workplaces and to allow people to work from home when that's operationally feasible. And finally, we're strongly recommending that unvaccinated Albertans limit their indoor social gatherings to close contacts, a maximum of 2 different families, up to a total of 10 people. Vaccinated Albertans do not need to take similar precautions. This is for Albertans who are unvaccinated. And I know that this is disappointing to some who have started to move back into their office, some that have planned large social events. These steps are the least intrusive things we think are needed, and they're temporary. We'll get through the increase in cases, and as we've done before, and with less disruption of people's lives. Testing will remain available to those with symptoms, and isolation remains required for those who are sick. If you are sick, even a little bit, you need to stay home. We need to bring these measures back to keep us safe. And we're confident that these things, along with the power of vaccines, will be enough to see us through with relatively small impacts on our lives, on our economy, compared to what we've seen previously throughout the pandemic. The path out of the pandemic is more clear than ever. We need more Albertans to get vaccinated. And that's why today we're also announcing an incentive program for all Albertans who are over the age of 17, so everybody 18 and older, who have not received a first or second dose yet. Starting immediately, every Albertan who receives a first dose or a second dose of COVID vaccine between September 3rd and October 14th is eligible for a pre-filled debit card that's worth $100. Everyone who registers and has their vaccines confirmed will receive one of these pre-filled cards. Eligible Albertans will be able to enroll online to get a debit card, and that registration process begins online September 13th. More information is available at our website, and just a reminder, that is alberta.ca/vaccine. And this is just the latest on our ongoing efforts to get more Albertans vaccinated. We've held rapid flow-through clinics to vaccinate thousands of people per day. We've held walk-in clinics. We've brought vaccinations to workplaces and community centers with pop-up clinics. We've got a vaccine bus that's been going around the province throughout August and still going throughout the province. We're running awareness campaigns to let Albertans know that vaccines are available and directing them to more than 1,000 pharmacies and clinics where they can get the jab. And soon we'll be holding vaccination clinics in junior high and senior high schools all over the province. And we're going to keep it up, and we're going to keep trying any promising new option as long as there are Albertans who remain unprotected. Vaccination has changed the game, just as we said it would. The problem is that the virus has moved the goalposts on us, and now we need to drive the numbers even higher. And we can do that. We've seen rates move up in other jurisdictions for a variety of reasons. But we're going to have to work even harder to get further gains, and we'll keep doing just that. Now, before I turn it over to Dr. Hinshaw, I want to say a word about our healthcare system. These past 18 months have been hard, and the next few weeks are going to be another challenge for our nurses, our doctors, and others throughout the healthcare system. They're tired, and they can't all keep working and being available the way that they've done before. We know that. We feel for those who are working in our hospitals, and we're grateful for them. We need to be realistic about what we ask of them, and our planning reflects that. That said, the system will be there for Albertans who need care. And that means individual doctors and nurses, others will be there. I know how deeply they care about their patients, and I promise them that we'll support AHS in any way that's needed to make sure that they can give patients safe care. Thank you, and I'll now turn it over to Dr. Hinshaw to be able to provide her update. Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. I'm pleased to be here to provide another COVID-19 update. Our full data update will not be available until 3:30 p.m., so I will be providing more general information about the current situation in Alberta. Today, I will also be referring to some charts and graphs. Unfortunately, we were unable to arrange them to be shown on the screen today. We have hard copies for reporters in the room, and there is also a direct link in today's news release posted online at alberta.ca/COVID-19. As you know, there has been an increase of cases over the past few weeks, and more concerningly, there has also been an increase in hospital admissions for people with COVID-19. It's important that we're watching those trends closely, and the recent increase in deaths is another concerning factor. I extend my condolences to the friends and family of all those who have lost someone due to COVID-19. COVID continues to look for any opportunity to spread, and as you have heard, currently that opportunity is, unfortunately, those who do not have vaccine protection. As the Minister has said, there is one thing we know that can limit new cases and prevent severe cases, long COVID, and hospitalizations over the long term, and that is vaccine. We must still remember that every Albertan child younger than 12 years has not had the chance to receive vaccine yet, and as students return to school this week, I know this fact is top of mind for many parents. I would like to reassure Albertans that children still have very low rates of severe illness compared to other health risks. Since July 1st, we have not had any hospital admissions for COVID in those between the ages of 5 and 11, and hospitalization rates for children with Delta infections have not increased beyond what was previously seen with other variants. To give some context on the risks of COVID for children, there is a chart in the modeling and data summary online that shows the difference in population risks of hospitalization for kids under 12 over the course of 1 year. The risks of hospitalization for influenza and RSV for young children in a pre-COVID year is similar to what we saw for population risk of COVID last year in children under 12. In addition, there are other risks that are much more substantial for our children, such as injuries, which also need our attention and consideration. The point of this comparison is not to say that hospitalization of a child for any reason should be ignored, but rather that we need to consider all risks our children face, as well as the risks of interventions that may be put in place as we make decisions about our children. What we can do to protect our children against COVID-19 is to make every effort to have all adults and older children around them have both doses of vaccine. Having widespread COVID-19 vaccine uptake and protection is the one way we will be able to live with COVID without unsustainable, restrictive measures. On that note, today I would also like to talk about the evidence that informed my recommendation earlier this summer to shift to an endemic COVID approach and how our current situation has changed that. It remains important for us to work towards a sustainable approach to managing COVID-19 that considers the harms of interventions as well as direct harms from COVID. It is also critical that we continue to adjust our response as needed when new information becomes available. I know there has been keen interest in how I came to the original recommendations, and my team has worked very hard to bring all the relevant data together in a way that is easily accessible and understandable. While we have excellent software and resources to use in analyzing the data, at the center of our analysis are people in our analytics and planning teams who have been working non-stop for the past 18 months. I'd like to acknowledge and thank them for the long hours they have and continue to put in. They have helped me finalize the evidence summary, including previous modeling, and this has been posted online today to lay out the information we had 2 months ago when we prepared our forward planning recommendation. This evidence summary includes key assumptions and considerations, hospital impact modeling that was developed in late June, and a list of references for further reading. At that time, based on the information available, I believe that the best course of action for Albertans to balance all health risks was to move to an endemic approach. But as I said in mid-August, COVID-19 continues to evolve, and as we always have, we continue to look at new and emerging evidence. My recommendations are always based on the best information available at any given time, which is why as new variants, trends, or data emerges, recommendations can change as well. Albertans' overall health, considering all health risks, is at the center of every recommendation I make. So as I have throughout the pandemic, I will continue to adjust my recommendations as needed. This is why we paused changes to testing and mandatory isolation several weeks ago, and why we are announcing changes today to address our current situation. To illustrate the difference between what our modeling looked like 2 months ago and what it looks like today, I would like to share what we are seeing at this point in time. Additional graphs in the document posted online show our current modeling estimates for case trends over the coming weeks. The impacts are much higher than in previous models, with later and higher potential peaks. It should be noted that there are no guarantees of when our peak will arrive, and this modeling assumes a constant mixing pattern amongst the population. We know that behavior and contact patterns will likely change in September as fall activities begin, so it is likely that the peak hospitalization and ICU numbers will exceed these current predictions if we do not implement public health measures now. This model has a high, moderate, and low curve that reflect possible futures. When looking at the current projections of the ICU burden over the coming weeks and the actual numbers trending sharply up over the past week, we have crossed from the low scenario, moving up towards the high, and it is clear that we are at risk of exceeding our province's ICU capacity if we do not make changes to our approach now. Our non-ICU hospital admissions are also trending on the high side of all projection lines, and we could exceed even the high projections in the coming weeks if no changes are made in our public health approach. To provide additional context of the varying risks and the impact of vaccines and not being vaccinated on the current hospital burden, in another chart in the data summary, you can see that the risks of COVID hospitalization in fully immunized adults are extremely small, while the risk of COVID hospitalization in unimmunized adults is higher than COPD or heart disease and approximates the risk of cancer admissions. Unimmunized adults are taking a significant risk for themselves and also for their community by not accessing the protection that is available. What all of this means is that we are at risk of not having enough hospital capacity for COVID and other health issues of Albertans within the coming weeks if we do not take action together. In recognition of this, as the Minister just announced, we are resuming mandatory masking in indoor spaces province-wide and putting other measures in place to slow transmission and protect our healthcare system. These measures are needed to keep healthcare available for all Albertans, and the best thing we can do to get to a point where we can lift restrictions is to have as many people as possible get the protection that vaccines offer. Vaccine is a powerful individual action that benefits all of us. Viruses will continue to evolve to try to get to us, but if we continue to take basic actions every day, like staying home when sick, wearing our masks regularly, and getting vaccinated, COVID will lose its power. Thank you, and I'm going to turn the podium over to Dr. Yu.
Good afternoon. When I spoke with the media earlier this week, I stated that the pressure on our healthcare system was building. So today we are taking additional steps to relieve some of that pressure and in turn ensure that we can continue to provide care for those who need it. The number of Albertans needing ICU care has increased rapidly in the past week. And while our frontline teams are doing an incredible job in caring for Albertans, we need your help. Beginning this morning, AHS is going to be postponing non-urgent surgeries and procedures across all 5 zones. The specific number of postponements will be determined by the zone. All patients who are affected will be contacted directly by Alberta Health Services. As we have throughout the pandemic, AHS will maintain urgent and emergent procedures as well as prioritized cancer surgeries. To date, service adjustments have been announced in North and Edmonton zones. Today, we are announcing service adjustments, as I mentioned, in all 5 zones. In the North Zone, surgical postponements will be up to 60% expected for next week. In the Edmonton Zone, postponements of non-urgent surgeries and procedures will increase up to 50% from 30% last week. Some non-urgent pediatric procedures will also be reduced by 30% in order to support adult critical care. Central Zone will be postponing up to 40% of endoscopy procedures and up to 30% of scheduled surgeries. Calgary Zone and South Zone are also postponing up to 30% of scheduled surgeries, endoscopy, and outpatient visits. Additional postponements will be shared proactively with the public. We do not make these decisions lightly, and we acknowledge that postponing surgeries and procedures has a very deep impact on those impacted patients, families, and their loved ones. But it is imperative that we maintain capacity in our hospitals, not just for patients with COVID-19, but for any Albertan who needs care and critical care. I've heard that the current situation is only impacting those who are not immunized, and it is true that the majority of COVID patients in our ICUs and hospitals are not vaccinated. I strongly urge all eligible Albertans to get immunized as quickly as you can. Please don't hesitate. The vaccine works. It protects you. It protects your loved ones. It protects our communities, and it protects our healthcare system. We need your help. And as we head into this long weekend, please stay safe. Thank you.
Thanks, Dr. Yu. Thank you, Premier, Minister Shandro, and Dr. Hinshaw as well. We will now move to the Q&A portion of today's news conference. For those in person in Calgary and in Edmonton, there is a microphone for you to ask your questions, just so everyone else in the room can hear. We'd ask that you line up there. When you go to ask your question, please just state your name, outlet, as well as who you'd like to direct your question to. And we will alternate between locations as well as the phones today. So with that, we will start with our first question on the floor in Calgary, please. Go ahead.
Thank you. Chris Epp from CTV News. Minister Shandro, why are you bribing people who refuse to get the vaccine? Why not instead say, you didn't get the shot, you can't go to the bar, you can't go to the mall, you can't access all these services? Because right now you've got millions of Albertans who got their vaccines who are going to be very upset by this.
Well, we looked at, as I said, in what I said previously, is we're looking at what the options are, and this is a process that was used successfully in the United States. Colorado would be an example in being able to increase their vaccination numbers. So if that was successful in another jurisdiction, we're happy to be able to look at those types of innovative ways to be able to increase our numbers here for both those who have not gotten any doses, but also those who are partially vaccinated get that second dose.
What you and the Premier referred to as the right thing to get their shot, this is simply ignoring what so many people have done and rewarding those who've been obstinate and refused to get the vaccine, often not for health reasons, just for whether it's ignorance or other reasons.
I wouldn't accept that. It's ignoring what people have done, the right thing. The 2.6 million Albertans, as I said, have done the right thing, rolled up their sleeves and gotten the jab, and we thank them. We thank them profusely because they did the right thing. And now we have to, and I think Albertans, those 2.6 million Albertans who see that those who are unvaccinated, especially those who are between the ages of 20 to 49, who have not gotten the jab yet, for us to do everything that we can to be able to increase our vaccination rates here in Alberta. So I think though everybody is wants us to be able to look at innovative ways to be able to increase our vaccination rates.
Okay, I think we will come to the room in Edmonton here. Go ahead.
Hi, it's Janet French from the CBC. Somebody internally to the system says that there's only one empty ICU bed today in Edmonton. Can you please confirm this and also explain what is your plan to care for all critically ill patients once that bed is full?
Yeah, so I would say that the teams are working extremely hard on a daily basis to increase our capacity. We're building additional surge beds throughout the province. And right now we've built about an additional 47 surge beds on top of our 173 baseline. There are more beds than one in Edmonton zone, but it is tight. There's no question about that. And we are building more capacity in anticipation of the long weekend, as well as for next week. We're always trying to keep on top of the projections according to the early warning system that we've developed in Alberta Health Services. But it is going to be a struggle. There's no question about that. But the teams are working very hard.
Follow-up is for Dr. Hinshaw. So the most recent plan was that contact tracing was still on its way out, just very specific situations, and that testing and isolation requirements were to go away September 27th. How does all of this modeling change the timeline for those measures? And if not bringing back contact tracing at this point, why not?
We're looking closely at the timeline for testing. We're looking closely at the timeline for that particular point in time at the end of September with respect to self-referral testing and mandatory isolation to determine what is more appropriate in terms of a timeline on those pieces. With respect to contact tracing, it's important to remember that what we know from our serology data is that we are only capturing, throughout the pandemic, we've only captured about 1 in 4 of our actual COVID cases in the community. And we suspect that there may be, again, that's a maximum number. We think that we may be catching even fewer of them now. And what we know is that contact tracing in a time when there are no public health measures and people have many, many, many contacts over the course of 2 weeks is extremely labor intensive. And so having teams of thousands of people doing contact tracing for everyone in the population when we're not requiring quarantine for fully vaccinated people is a huge investment of resources. Many of those individuals are healthcare workers who are needed in other parts of the system, as you've heard about the intense pressures. And so it was the decision to shift contact tracing, focus on case investigation, make sure that people are able to get that testing, that they know that they have to be isolated in a mandatory way, and utilize contact tracing in high-risk locations, such as acute care and continuing care. And that is what's underway. And we're working with Alberta Health Services to support them as they shift their approach over time to be able to make sure that we're able to follow up on cases. We're able to, again, identify those high-risk exposures and follow up on those. But the utilization of a very large workforce, again, including many healthcare professionals, for an intervention that ultimately is going to only identify a minority of cases, and when most people wouldn't actually have a need to quarantine, again, in my mind, is not an effective use of scarce resources.
I think we will go to the phones for our next question. Operator, can you please put through our caller?
Question from Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. This question is for the Premier. I'm going to try to follow my colleague Chris up on this question. Premier, I'm gobsmacked again. Do you realize what kind of a message this sends when essentially you're paying people who have held out from getting the shot and who you insist today strenuously are the biggest part of the problem, are the problem right now, and that you're actually giving them something? Do you realize what kind of a message this is going to send to the 7 out of 10 Albertans who have gone out and got fully immunized or not?
Rick, I wish we didn't have to do this, but this is not a time for moral judgments. This is a time to get people vaccinated. We have done everything we can, left no stone unturned, made it as easy as possible. We're the first province out there with the big lottery. We've had a bus running around the province. We're the only province with a billing code that allows doctors to bill for proactively calling their patients who are unvaccinated to share medical information with them. We have left no stone unturned, and yet we have the lowest vaccination rate in Canada. We are about 5 percentage points below the Canadian average, and that is why we're getting hit harder. And if the choice is between a sustained crisis in our hospitals, or God forbid, widespread restrictions, which I want to avoid at all costs, or finding some way to get the attention of those vaccine latecomers, we're going to choose the latter. We're the only province to do it. It's worked in some of the U.S. states. I wish it didn't have to come to this. But I'm much more concerned about protecting our hospitals than I am about the message, some abstract message that this sends. The message it sends is a very simple message. If you've been holding out and you just haven't gotten around to it, it's now literally worth your while. Now, let me add one other piece to this, Rick. We do know in research around most of the world, we don't have this specifically in Alberta, but if we're all similar to research across in other parts of Canada, the U.S., Europe, we do know that vaccination rates amongst people in lower income groups tends to be higher. And so this financial support may remove some of the barriers. Imagine that you might be a very low income person who living in a remote area who can't afford the gas to drive into town to get the shot. This will help. This will cover you. Maybe you're a very low income person who can't afford a taxi to go to the local pharmacy, what have you, and you've had trouble, you're not aware of the free ride shares that we're offering. This will give you that little bit of help. So I think this may also help to reduce barriers for some of the folks who might be facing barriers because of lower income status, and that might help them a little bit as well.
Can I chime in with a supplemental now?
For sure, for sure.
Yes. So let me get this straight. 8 o'clock in the morning tomorrow in indoor public spaces, the fully vaccinated, everybody, including the fully vaccinated, will put their masks back on. But you aren't, and I'm not saying you should do this, I'm saying why didn't you do this? But you're not restricting access to non-essential settings for like bars and restaurants for those people who are not fully vaccinated. An idea that pollsters say is favored by many Albertans, and an idea that other conservative governments have done. So perhaps you could explain how you kind of square this circle that the fully vaccinated tomorrow will have more restrictions on them than they have today, but the unvaccinated will emerge today with $100 more. So,
well,
I just don't understand how A equals B.
They only emerge with $100 more if they do the right thing and get the jab, protect us, and get this thing under control. And so we're going to try everything we can. And this is the next step. We tried the lotteries. We saw an uptick. It helped a bit. And we're going to try this. And we don't know if it'll work or not. But I'll tell you this, Rick, if we can get 5 extra percentage points of the adult population to step up with this small financial incentive, this $100 card, that'll cost us around $20 million. That's real money. But that is a fraction of the cost of what it would to taxpayers to hospitalize many of them. It will be a huge cost savings relative to the hospitalization of many of those folks who might now get vaccinated. So this is actually a money saver for taxpayers. We are sure of that based on the experience we've seen in U.S. states that have done this. And in terms of restricting access to places, many in the private sector are already doing that. I'm going to the Labor Day Classic at McMahon Stadium on Monday, and the Stamps, like the other CFL teams, are requiring proof of vaccination. We are providing more convenient proof of vaccination documents. We're also doing the policy work to make it possible for people, if they want, to get a QR code on that proof of vaccination so it's machine readable. So in the future, we can avoid slow-moving long lineups at events like that, and also to help Albertans who want to travel to other provinces that have vaccine restriction policies. So we are trying to facilitate people's choices if they're going into venues that are that don't permit unvaccinated individuals. But we're going to give everything a shot here. And if we can get a few more percent to step forward because of this incentive, particularly perhaps some of the lower income people who for various reasons have barriers, then I think it'll be worth it and it'll save us a lot of money in the long run.
Okay, I think we'll go back to the room in Calgary. If you could go forward with your question, please.
Sure, it's Alana Smith with the Canadian Press. My question is for Premier Jason Kenney. You've been absent for weeks while case numbers and hospitalizations have spiked. Doctors have hosted their own press conferences to update Albertans on COVID in your absence. So I'm wondering, why did you not designate somebody to speak on your behalf while you're away on vacation? And how do you consider tweeting during a crisis leadership?
So I took a 2-week break, summer break. Haven't taken a 2-week break. I've only had one other 2-week break since 2015. I've done more news conferences in the month of August than, as far as we can tell, any other Canadian premier. I was in daily contact during my private time with my staff, with senior officials, with fellow ministers. I had regular COVID briefings. We made, while I was on my private time, I participated in making decisions related to COVID, including the recently announced one around booster shots, including the requirement for vaccination of AHS staff, and other recent decisions. So I've been engaged in all of that. And the Minister Shandro has been here, of course. I've continued to be engaged while getting a bit of a personal break. Another part of the context here, of course, is that we are in a federal election. It is conventional, for obvious reasons, for governments not to do a lot of announcements and news conferences while there's an election happening at another level. When I was a federal minister, we were always told when there was a provincial election not to make any announcements to news conferences, so we wanted to avoid the perception of using provincial, or in that case, federal government resources to interfere in a different election. So that's, I think, one of the reasons that why all of the premiers have been taking a relatively low profile through the past few weeks. That includes me, but I've been completely responsive to the events as they've developed.
Sure. Another question for you on a different topic. Quebec, BC, and Manitoba have all implemented, in Ontario, have all implemented vaccine passports. You've stated in the past you're concerned about the passports violating health privacy rules. If that's the case, what legal or privacy commissioner advice have you received on that? And if you're still concerned, why are you allowing businesses and sports teams to potentially violate the health privacy of thousands of Albertans via these passports?
So, yes, I have recently received advice from lawyers at the Department of Justice and Health in that respect. And to summarize it in plain English, what they're saying is that it really depends on the context and the circumstances, that there has to be a compelling rationale in order for that kind of requirement to be put in place. We concluded that for healthcare workers, there was such a compelling rationale. So we'd have to look at that on a case-by-case basis. As I just indicated, the Department of Health is developing a QR code technology that can be added to the vaccine report that people can download from their My Alberta Health records that can help people who do want to access venues that are restricted based on vaccination status. And let me say this, that if people who are deciding not to get vaccinated, look, we're not going to forcibly jab people's arms in this province. We actually removed the mandatory power of inoculation. But we would just ask them, if that's your decision, then please limit your social interaction. One of the strong recommendations we are making today is for unvaccinated individuals to limit indoor socializing privately to no more than a 2 household cohort group.
Okay, we'll now come to the room in Edmonton.
Audrey Neveu from French CBC. My first question is for Dr. Yu. Dr. Yu, we have information that provincial ICU capacity is right now at 95% and Edmonton's is at 97%. Can you confirm if this is accurate?
Yes, correct. As of this morning, it was, as you had mentioned, the numbers is 95% provincially. I think one of the benefits of the integrated provincialized system is that we're actually able to work provincially to make sure that we're able to spread the resources across the province. And so, although Edmonton may be really tight, we do know that we potentially have some more spaces, for example, in Calgary and in South Zone. So understanding that we're able to shift the resources to make sure that we've got adequate resources across the province.
Thank you. My second question is for Premier Kenney. I'll ask it in English, but if you could please answer in both English and French, please, that would be appreciated. What makes you think that the measures you're announcing today are sufficient to curb the high number of cases we're seeing right now to a level that would protect the ICU capacity we've just talked about? And why didn't you act a week or two ago? It seems your government was incapable of taking these measures in your absence.
That's completely untrue. During my personal time, was receiving regular COVID briefings and was in daily contact with my office and senior officials. Secondly, I was briefed on Tuesday. I've been working all week here at McDougall Centre on primarily this issue, and was briefed on Tuesday about recommendations that we're now announcing today. And what makes me confident that they will be effective? Well, this is the advice we've received from the Chief Medical Officer. I would invite Dr. Hinshaw to share her perspective on this. You can see in the modeling that the Health Department has released today a expectation that we will reach the peak towards the end of September. I quickly qualify that by saying that the peak could be longer and later. But when we look at the performance of other jurisdictions with similar levels of vaccination and add into it dozens of other data factors here in Alberta, that's what produces that model. That's based on an assumption of constant levels of social interaction, of social mixing, and we are concerned that in September, as people come back, people come back to work, etc., that there could actually be an increase in social interaction. That's why we are taking the measures that we are today. I know that some people will be frustrated with the mask measure, but please understand that the science is now, I think, very clear on this, that effective, widespread utilization of masks in public, in indoor places can have a meaningful effect in reducing transmission. And to Rick Bell's earlier point, it is possible for people like myself who are fully vaccinated to still transmit. They are less likely to do so than people who are unvaccinated, but it's still possible for them to transmit. And that's why one of the reasons why this is a widespread mask mandate. It would also be effectively impossible, I think, to police a mask mandate that is limited to unvaccinated people. So, I mean, how would you imagine you're running a shopping mall? Are you going to go around and ask everybody about their vaccine status? It would be, I think, practically impossible. So, the advice that we have received from the chief medical officers that these measures will be effective in this context. And Dr. Hinshaw, I invite you to add anything to that. And I'll come back in French and try to summarize that.
Thank you, Premier. I'll just say that I brought forward a list of recommendations to Cabinet Committee, which I felt were my best attempt to balance measures that would have a reasonable likelihood of effectiveness with the current situation, and at the same time consider the unintended consequences of restrictive measures. It's never possible to predict with 100% certainty what the outcomes will be, but the list of measures that I brought forward, I believed were a reasonable balance of those two goals.
And I'll just try to do a little summary in French, as you requested. Quand j'étais en temps personnel, j'étais en contact quotidiennement avec mon bureau et les officiels. J'ai reçu régulièrement les briefings sur la situation de COVID-19. Cette semaine, j'ai reçu ces recommandations du ministère de Santé et on les a acceptées au comité du cabinet et nous les annonçons aujourd'hui. Alors, nous avons reçu le conseil de officier médical, l'officier chef médical, que ces mesures seront effectives et aujourd'hui également, nous dévoilons les modèles qui proposent une diminution des nouveaux cas, des hospitalisations à la fin de septembre. Alors on va continuer à suivre évidemment de près la situation et en bout de ligne, nous prendrons les mesures nécessaires pour protéger le système de santé.
All right, we have time for 2 more questions. I think we will go to the phones for 1 more, and then we'll finish in the room in Edmonton. Operator, can you please put through our next caller?
Sorry.
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. This is a question for the Premier. The projections that we've seen today show potentially higher hospital and ICU admissions than any of the previous waves, despite the vaccine numbers. And yet the government is doing far less in response in terms of sort of the aggressiveness of these policies. Why is that? And why is the response so much less aggressive than we've seen in the previous 2 waves?
Well, again, I'll ask Dr. Hinshaw to supplement my answer, but what we're dealing with here is a much smaller population through whom the virus is running. We are not dealing with 100% of the population now, but 30%, and effectively because younger children are much less likely to transmit and have severe outcomes. When you're talking about adults here, we're talking about 25% of the population approximately. So, and a certain number of those individuals have antibodies through prior natural infection. That number, of course, is growing through the current wave. So there is a much smaller target population for the virus, if you will. And secondly, you can see, James, if you look broadly at other jurisdictions that have been affected by Delta waves but have had high levels of immunization, well, I think with the exception of Australia and New Zealand, none of them have resorted to the kind of blunt instruments of widespread restrictions that we used earlier in the pandemic to bend down the curve and preserve health capacity. So, and that's because of the difference, the epidemiological difference in population protection that we now have. So, again, we're basing this on the performance of other jurisdictions with similar levels of vaccination. And with that, Dr. Hinshaw, would you like to supplement that?
Thanks, Premier. Just to comment that, as you said, this wave we anticipate will be different from previous waves as it is a smaller group of the population who is susceptible, and that this particular suite of measures, again, is the list that was brought forward is an attempt to balance the impacts of measures against the impacts of the virus, recognizing that what we see in the data clearly indicates that the vast majority of those who are fully vaccinated have a very high level of protection against not only infection, but more importantly, severe outcomes. And so it's important to make sure, as I have always done my best to balance in my recommendations, direct impacts of COVID against the indirect impacts of restrictions. And so that list that I brought forward again was my best attempt to do so.
And did you have a brief follow-up, James?
Yeah, a question for the Premier on a slightly different topic, although related. I mean, you've said several times today and previously that it would be inappropriate to make big announcements or to weigh in on federal policy during a federal election. Why is that the case this time? But in 2019, you traveled to Ontario to campaign for Andrew Scheer. I'm just wondering why you felt comfortable 2 years ago to campaign very actively in a federal election.
Well, the distinction, fair question, James. The distinction I would make is to make government announcements, typically about spending government money, is something we try not to do while there's an election happening at a different order of government. So that's really what I'm referring to. You can go back and check that. I'm pretty sure I wasn't making any significant to holding news conferences about major government policy initiatives or funding announcements, for example, which is typically what we would announce at a news conference. And in terms of the partisan politics, given the situation, obviously I'm staying focused here, and we're not. The reality is that totally different in the context of this federal election with the pandemic. You'd have to ask the Prime Minister why he chose to call the election right now. But for my part, we are observing that convention of not doing major announcements throughout the federal grid.
Okay, we'll now go to our last question here in Edmonton.
Hi, the question is for the Premier. It's Bill Fortier from CTV News. The first question. Premier, back on June 18th, you announced that Alberta would open sooner, wider, and faster than any other province in Canada. When you were asked about the possibility of cases going up, hospitalizations, ICUs, you said, we just don't see that scenario. You called the people who did the promoters of fear. The scenario is now here. I'm wondering, do you think that was the wrong thing to do? Was that the wrong decision to open up that quick? And what do you say to the people you called the promoters of fear? Thanks.
I think we made a decision based on the evidence in front of us, including the experience of other jurisdictions with Delta waves, and similar levels of vaccination. You know, I'll remind you that virtually every other Canadian province has substantially lifted their public health measures. Some that have seen mid-late August Delta waves have introduced modest new measures, as we are doing here today. And so we've always known that we have to respond to this as it comes. I also said that I thought a fourth wave of this was inevitable. I think I said it was guaranteed. The question I said was that the protective effect of vaccines would make the challenge of COVID-19 quite different in the future. The reality is we stalled out on vaccines. It's taken us 2 months between June 18th and the third week of August to move the numbers up by 3 percentage points on first dose inoculation from 75 to 78%. And we lost momentum in terms of vaccine coverage, particularly amongst people in younger and middle-aged groups. That is what we're addressing here with the monetary incentive and leaving no stone unturned to get people the protective effect of the vaccine.
And the follow-up is for Dr. Hinshaw and Dr. Yu. The Premier has said 3 or 4 times now that the province has left no stone unturned in terms of increasing vaccination. Of course, there's a pretty big stone, and that is proof of vaccination, which every other province in Canada with populations in the millions are doing. What are your professional opinions on whether or not Alberta should bring in a proof of vaccine program like BC, Ontario, Quebec, and Manitoba?
Policy decisions always need to be made in the context of a particular population, and the reason that policy decisions are made by elected officials is because they do need to reflect the context of that population. It's clear that in other populations, when a requirements have been introduced, that uptake has increased, and at the same time, that is not, again, without some impact. So again, those kinds of decisions need to be made taking into account local context as well as what's been seen in other jurisdictions.